following information is presented for discussion and educational purposes only and is not intended or provided as treatment information for any specific person or behavior. If you or a loved one is having behavioral difficulties, you are encouraged to seek professional consultation as soon as possible. Ladies and gentlemen, welcome to episode 20 of Ask the Behavior Doctors. My name is Dr. Jacob Boney, and I'm the owner and clinical director of Scottsdale Pediatric Behavioral Services. We're here in Scottsdale, Arizona today, answering your questions about ABA. So today's question comes from a mom, and it says, Dr. Jacob, is ABA safe for my child? I have heard some horror stories recently about kids being punished, restrained, secluded, denied of basic rights like food and drink. I've heard that children can be allowed to just scream and cry for hours, and that no one will even try and comfort them. I've even read a recent article written by an ABA therapist that says she felt like she was paid to abuse children. I'm very scared and uncertain if ABA is the right choice for my kid. Can you help explain why people would say this and what I should do as a mom? I'm really glad I got this question because unfortunately, a lot of people think this stuff but won't say it out loud. Number one, I want to admit that unfortunately, some of this stuff could be true for some providers, and some of this stuff was much more true in the past. ABA has unfortunately gotten a bad reputation because of that. So in the past, kind of part of our history, ABA was used to treat patients in like mental institutes or mental health hospitals. People who are institutionalized used to receive treatment from behavior analysts, and a lot of that treatment focused on behavior reduction. So of course, to reduce behavior, it's pretty typical that you use punishment procedures. And because of that, ABA became known, unfortunately, to be very aversive and to be very punishment-based. Throughout the years, I mean, again, this was probably back in the 1960s, 70s, and 80s. In the last 20 years, ABA has really made a shift to being much more function-based and much more reinforcement-based. We don't use nearly as many aversive procedures as we used to, and we are ethically now required to do functional assessments, to use evidence-based practices. However, again, I want to validate that the old ABA used to do a lot of this stuff. And I also want to validate that there are some poor providers that might be doing things that could align with that perception. So I just want to explain some of that. Our growth recently as a field has been rapid, especially here in the state of Arizona. We just got licensure in 2011. The number of licensees has tripled or quadrupled almost every single year. Whenever you have a rapid growth like that, you're probably going to have a dilution of quality in providers, meaning you're trying to get providers quickly, but there aren't even enough programs to train or to supervise or to oversee the development of these behavior analysts. And unfortunately, when you have that poor training and that kind of rapid succession and growth, you're going to get that dilution in quality, and they're going to pass on that low quality training they got to the trainees that they're now overseeing and training. So parents, again, no excuse for providing poor services, but because of the rapid growth, the quality definitely has been diluted a little bit. So you're going to want to look for someone with some experience. So again, I wanted to start off by validating. However, I'm here to answer definitively, without a doubt, that quality ABA is nothing like that. ABA is not abusive. ABA is not restrictive. ABA is not punishment-based. That is not what quality therapy looks like. And if that's the quality of therapy your child has received or is receiving, my advice to you is to stop that treatment immediately, find a more quality provider, and get your child put into a place that is much higher quality. So I'm going to talk about now why ABA is safe. ABA is data-based. Okay, treatment is monitored very closely. The best ABA providers take very frequent data. They monitor that data on a daily basis, and they will be able to tell quickly if something is or is not working. The data is critical Because we take that data so meticulously and monitor that data so meticulously, we can make finely tuned adjustments in a very responsive way. So I promise you, if your child is spending sessions crying or upset or whatever, they're not learning. That's not a quality receptive learner, and they're not going to make very much progress. And because of that, the programs or the treatment should be shifted quickly. So again, ABA is very data-based. They're only supposed to do, and they only should do, what's working for your child. ABA is well regulated now, especially recently in the last 10 to 15 years. Licensure has become much more popular here in the state of Arizona. Remember, we got it in 2011. Licensure, the sole purpose really of licensure is to protect the public from practitioners and to regulate and monitor a professional field of practice. So because of that licensure, I believe 13 to 15 states now have licensure, and probably 10 to 15 more in the next few years are going to get it. I absolutely see a day where almost every single state in the U.S. will have mandatory licensure for behavior analysts. Again, this is a good thing for the public. Licensure helps to maintain and regulate really high standards of practice for licensees, and if we don't maintain those high standards, we won't be able to renew or maintain our license. ABA must be effective. You must have a simultaneous increase in adaptive behaviors and a simultaneous decrease in maladaptive behaviors. You've got to do both at the same time. If both are not occurring, then good ABA is not happening. Again, parents, if you're in a current situation where you don't feel like the good is increasing and the bad is decreasing, you need to talk to your supervisor, and if you don't feel like the supervisor has a plan to address that, you need to seek another provider. Competent behavior analysts have specific decision protocols. Here, we have decision protocols that call for specific action after a certain number of things. Like, for example, if you have an overall 5 descending data points, you're probably going to stop a program and you're going to make an adjustment or utilize what's called a tactic. If you have 3 simultaneous decreases, you're probably going to stop a program. If you have an overall 5 data points of increase, you're probably going to continue a program. These what are called decision protocols are really critical. Again, I want you, if you are currently receiving ABA therapy, to talk to your supervisor about their decision protocols. If they don't have them, you might want to suggest that they get them. These are critical. Again, not only does that mean that the decisions are data-based, but that means that they're going to make decisions quickly, that they're not going to continue to do what's not working for your child. Again, I'm trying to explain to you why ABA is safe. And because of the use of these decision protocols, that's meant to keep treatment much more safe, much more monitored, and much more effective. ABA treatment has changed in the last 20 years tremendously in the fact that procedure basically called functional analysis was really emphasized and created. Functional analysis helped us identify the function of problem behavior much more quickly and much more efficiently. In the last 5 to 7 years, there's been even a modification to the functional analysis process called synthesized functional analysis, and these synthesized processes make it much more quick, much more humane, much more safe, and much more efficient. So even the functional analysis process has gotten much safer. And what that leads to is, like I said, very specific, tailored, function-based treatments. So in the old days, behavior analysts kind of used to go out of behavior and just try and decrease it. Well, now we have an ethical requirement or an ethical protocol called the fair pair rule, where for every behavior you decrease, you're ethically required to create a behavior to increase. Okay? So what that does is that creates and puts our focus on increasing behaviors with reinforcement-based procedures instead of decreasing behaviors with punishment-based procedures. So not only do we have a more efficient process to identify functions of treatment, that's made treatment much quicker, much more efficient, much more safe, but we also have an ethical requirement to focus on behaviors to increase. So again, all of this is in place to make treatment much more safe, much more effective, and much more humane for our patients. ABA should be fun and engaging and extremely helpful for your child. Children who are in a good mood, who are happy, who are motivated to see their therapist interact, they benefit from therapy much more quickly and much more efficiently. We don't want children crying, upset, inconsolable during session because they're not going to learn very efficiently. And when they don't learn very efficiently, our data looks really bad and it looks really variable. Behavior analysts who are maintaining a license and are supervising staff, they want to get the best results as efficiently as possible. Not only is it good for the patient, but it's good for a practice to have children make progress really, really quickly and efficiently. We want the data to look as good as possible. We want the child to progress. And like I said, because of that, we want the child in an optimal motivational state. When children are fun, or when children are happy, when they're positive, when they're really motivated, they're going to benefit from therapy much more quickly. Again, this is why, part of why ABA is safe is because we emphasize the child really being naturally motivated, wanting to have fun and being really close and paired really well with their therapist. So again, it would have no benefit to a provider or to a therapist to make it aversive. We have no motivation to do that. We have motivation to do the exact opposite. Ethical guidelines require that ABA practitioners utilize what's called the least restrictive interventions. I always tell my patients, we can't use a machine gun when a squirt gun would work just fine. We have to use the least restrictive intervention that will be effective in helping the patient increase their adaptive behaviors and decrease their maladaptive behaviors. Because of that least restrictive requirement, we're not allowed to use invasive or restrictive procedures without showing a progression of lower level things failing or not being effective. Remember, there is an ethical process to follow, and we must start with those least restrictive procedures. Behavior analysts are ethically required to get ongoing training. I'm required in my state to get 30 continuing education units every 2 years for licensure, to maintain my licensure. Because of that ongoing educational requirement, we are again required to utilize the latest and greatest evidence-based practices. There's constant research going on in behavior analysis, and we're required to utilize that research and those practices to benefit our patients in the most safe, efficient, and ethical way. So hopefully some of these things will make parents feel a lot more comfortable that ABA has significantly changed. ABA did have a bad reputation, but that reputation is getting much better. ABA is growing, and it's growing because it's effective. Remember, there's only one treatment approved by most insurance companies. This is one of the most evidence-based ways to work with children with significant behavioral issues or significant developmental delays, and that's ABA therapy. I mean, that should tell you a lot about its evidence base and the science behind why it's effective. Parents, I want you to form good relationships with your therapist. I want you to seek information. I want you to feel comfortable asking these questions to your providers. I'm confident any competent provider would be able to give you similar information that will make you feel comfortable and safe that ABA is the safest, healthiest, most effective choice to increase your child's adaptive behaviors and decrease their maladaptive behaviors. So, ladies and gentlemen, I want to thank you for joining us today. That brings us to the end. I want you to please continue to submit your questions to us at info@scottsdalepbs.com. We want to thank our photographer, Mr. Philip Carnevale of philipcarnevalephotography.com. I want to thank you again for submitting those questions and joining us here at Scottsdale Pediatric Behavioral Services and Ask the Behavior Doctors.